Hello, my name is SD Sherbach, and today I will be discussing the effect that social determinants of health have on ocular health and how to address these when treating a patient. This topic is interesting to me because I have witnessed patients struggle to receive decent ocular care due to certain obstacles in their lifestyle not being addressed by the doctor. I hope to spread awareness of this issue and incorporate this as a future optometrist as well. So, what really is a social determinant of health? According to the U.S. Department of Health and Human Services, social determinants of health can be categorized into 5 areas: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. Within these 5 areas, there are also subcategories like transportation, education, socioeconomic status, literacy skills, racism and ethnicity, housing and neighborhoods, clean water and grocery store access, and more. There are several ways that social determinants of health can impact ocular health. A study that was conducted in 2019 showed that air pollution, unreliable housing, children growing up in a single-parent household, high rates of violent crime, diabetes, and death by drug poisoning all had some impact on ocular health. This study was able to assess this by looking at patients with chronic ocular issues and traumatic injuries and using the 5 aforementioned areas of social determinants of health from the U.S. Department of Health and Human Services. Another study from 2016 examined a more specific connection of social determinants of health and ocular health. They specifically studied visual impairments and blindness. Through the study, several key points were made. First, there was a direct correlation between impaired visual function and adverse social outcomes in addition to mental and physical health. Second, those who were unemployed, had a lower job status, lived alone, or had mental health problems were more at risk to have poor vision. Third, having no education and being classified as an ethnic minority also meant that these individuals were at a greater risk of being visually impaired. So why do all of these studies really matter? What does it show us, and how can we make changes according to the results of the study? Each patient needs personalized treatment no matter how surface level their ocular issue is. It is the responsibility of the doctor to observe and ask the patient about their lifestyle, occupation, social life, and more that would allow the doctor to understand any obstacles that the patient faces. Based on this, the doctor should then treat the patient in a more personalized way. This is important because if the doctor fails to do so, the patient may not follow the treatment plan, may not return for a follow-up visit, may have poorer ocular health, and may develop more issues or problems. By proactively addressing the issues ahead of time, the patient experience and visit will be better and they will also be healthier. Some ways to proactively address social determinants of health are to begin by sending out a survey to a target population on how they would best like to receive information about ocular health, provide pamphlets about ocular health at the practice that address the target group, and more. Based on the results of the survey, the practice can provide educational sessions, informational videos, or even a live speaker event. If these events go well and help the target population overcome any ocular issues that are a direct result of any social determinants of health, these events can then be extended to the community so that there will be a greater reach. Although it will take some time and effort to make these changes as a doctor, it would be worth it because there is the opportunity and possibility to improve the overall health of the community. In the most ideal and perfect world, a practice that addresses social determinants of health may look something like this. Let's say that a patient struggles with healthcare access due to transportation issues. This patient, let's call them Sam, has to take nearly a 2-hour bus ride to see the nearest optometrist. Sam is due for his yearly eye exam, but for the past 2 weeks there has been some redness and irritation in his right eye as well. He couldn't go to get this checked out sooner due to his transportation obstacle. When Sam finally comes in for his checkup, the doctor notices that his eye is irritated. The doctor treats it, but requests that Sam come in for a follow-up. At first, Sam doesn't mention anything about how he won't be able to make it. After the doctor talks to Sam for a bit about his lifestyle, the doctor realizes that Sam won't be able to come in for a follow-up and proposes an alternative solution to the follow-up by asking if Sam would be able to virtually meet with the doctor. Sam is pleased that the doctor has recognized his predicament and has been able to accommodate him. After the 2 visits, the doctor reaches out to Sam and asks if he was good. Sam feels appreciated and cared for and will feel more motivated to return to the doctor in the future and care more for their ocular health. Making sure each patient receives the perfect experience is easier said than done. Creating educational and informational resources for the patient costs money, which is an obstacle that optometrists may face. If there is adequate funding provided that can be specifically targeted for education, there may be improvements in the ocular health within the target population. This concludes my presentation on the impact of social determinants of health on ocular health. Hopefully, this presentation has allowed the consideration of some important questions, like have I been doing everything I can to address social determinants of health, or what are some ways that I can engage with my patients more to address them? This is important since there is a significant correlation between those with ocular issues and those who fall into one of the 5 categories of social determinants of health. Thank you for listening, and here are my references.